The disadvantage of getting your ADN is that employers are more likely to hire someone with a BSN. There will also be certain nursing fields that you will not be able to apply for, such as nursing informatics. ADN versus BSN versus LPN. Which nursing path should you take? So, you want to become a nurse, but the problem is understanding what type of nurse you should be. You start looking up the path of nursing and you see ADN, BSN, and LPN. Now you're getting overwhelmed about which nursing path you should take. After this video, you'll have an understanding of the benefit to taking the path of the ADN, BSN, or LPN and which is best for you. What is the licensed practical nurse, also known as LPN? The length of the LPN program is the fastest route to becoming a nurse, which is 1 year long. Those with the LPN degree have the opportunity to move up and obtain an RN degree. It is also the most cost-effective, especially if you choose a hospital or company that provides tuition reimbursement. Remember that getting accepted into the RN program after obtaining your LPN license means maintaining the required GPA, 3.0 or higher in some programs' cases. One of the advantages of going down this route is that you can use your field experience to have a better understanding of your studies when you do go for an RN degree and have a higher chance of getting hired over your classmates without any previous experience. When I was studying for my BSN, I had classmates who were already LPN. They were able to excel in class because of their previous patient care experience. The LPN reports to the RN for any changes in the patient's condition. He or she cannot delegate, evaluate, or provide initial teaching or even assess the patient. The disadvantage of being an LPN compared to a RN is that the salary is lower and there are less opportunities unless you move forward and become a RN. What is a registered nurse? It can take 2 to 4 years to become a RN. The average program student opt to take is the 4-year program. Registered nurses are required to have more responsibility. For example, critical thinking. He or she will be expected to delegate to the team, provide care plans with the interdisciplinary team, assessment, evaluation, and patient teaching. Now, it gets even more confusing. If you decided to become a registered nurse, you need to decide if you want to get an associate's degree in nursing or Bachelor of Science in Nursing. The primary difference between the two programs are how long it takes to complete and the salary. Both programs will still offer the same curriculum, which includes but are not limited to maternity and newborn, pediatrics, fundamental of nursing, psychiatric, and community health. The BSN program will require more courses to be completed prior to graduation, such as nursing research. Before we continue discussing the benefits of the ADN program, don't forget to click the subscribe button below to stay updated on nursing. So the next question is, why should I choose the ADN program? The average time of completion, the ADN program is 2 years and is more cost effective. When you get hired, you can still continue your education and find a hospital or company that provides tuition reimbursement. You can still complete a BSN program without hurting your pocket. With the amount of student loan that is drowning graduates, this route is becoming the popular option. I've had coworkers that have even the same salary as me who had an ADN degree while I had a BSN degree. Sometimes degree does not affect what salary you will be getting, and sometimes it does. The disadvantage of getting your ADN is that employers are more likely to hire someone with a BSN. There will also be certain nursing fields that you will not be able to apply for, such as nursing informatics. Nursing informatics is a specialty field that requires a master's in nursing informatics, and you can only apply for that program if you have a BSN. So, why should I choose the BSN program? The average length of time to complete the BSN program is 4 years, which is the disadvantage compared to the LPN that requires only 1 year to complete. The BSN degree can also be costly in comparison. Depending on the college or university, it can cost between $25,000 to $120,000 or even more. You will not hear anyone having to pay $120,000 for an LPN degree. The tuition really depends on a number of factors from the location to the school's reputation. However, a huge benefit to selecting the path of obtaining a BSN is the salary. Of course, this will vary depending on the state and the location that you will be working in. For example, the average nurse in New Jersey can make $80,000 and work their way to six figures. This may be even higher if the nurse is in a specialized field, such as the ICU. An advantage is the opportunity to climb up the ladder. You also have the opportunity to apply for more jobs. Someone with a BSN can become a nurse manager or coordinator. A LPN will not be able to apply for those positions. With a BSN, you can get certification or get an advanced degree, such as a nurse practitioner. For me, I decided to go forward and obtain my master's in nursing informatics. This would not be possible if I had an LPN or ADN degree. If you already have an ADN degree, you can opt for the accelerated program and complete it in 18 to 21 months. It can vary depending on the school program. You don't have to feel as if you're starting all over again and waste another 4 years of your life. So ADN versus BSN versus LPN. You still have to take the NCLEX exam no matter what choice you go with. If you complete the LPN program, you will take the NCLEX PN examination, National Council Licensure Examination for Licensed Practical Nurses. If you complete the ADN or BSN program, you will take the NCLEX RN examination, which is the National Council Licensure Examination for Registered Nurses. For those with an ADN degree and completing the BSN program, you will be happy to hear that you do not need to retake the NCLEX. Now, I want you to take what you learn here and decide which path you think would work best for you. If you have any questions, drop them in the comments below and I'll be replying to everyone. If you're not already subscribed, click the red button below.